Hi again, Dr. Belziki. It's good to see you. So after we published your first 5-minute case, we received 2 questions. One of them is in the form of a comment and the other one came to my email. So I'll read the second one when we get there. Here's the first one. It wasn't clear to me where was there retained tooth material beyond the prostal margin. If not, I will often clear the chamber as did you, insert the pins or post if necessary, retro-trying the crown to ensure margin adaptation, and then core it, re-cement with a resin-based cement, example, Coreflow or the like. I would appreciate your comments and thank you.
Hello again, trying to answer these questions. And this was put forth by Dr. Caudry. So specifically to answer the question, you can see that here is some tooth material. This is the interior of the crown. And you can see a little bit of tooth material did break off that was apical to the crown margin. Even if it wasn't, when it's this badly broken down, I'm familiar with the technique you've mentioned. I've done it once or twice in my career, but I'm not totally fond of it. It's sort of, if it's an older patient, health issues, etc., and we're not sure about the long-term prognosis of the patient, not only the crown, yes, I will do something like that. But I'm trying to place restorations which will outlast me and the patient. So in this scenario, because it had broken just beyond, and I'm sorry I didn't take a picture of the tooth before I started prepping it, but there was about, because the crown was 30 years old, there was about 2 or 3 millimeters of recession that had taken place. So from about here down was really tooth structure that was available for crown preparation to incorporate into a new crown. So for that reason, and I'm dealing with a healthy patient who will live another 20, 30 years, he's in 70. I just wanted to put something in that would outlast him. So that's why I didn't do what you suggested. But as I said, we don't treat in a vacuum. We treat in, trying to incorporate all the various aspects of what the patient's needs are and where they are. And your technique, yes, I have done that in the past. But again, trying to marry what are the patient's needs and what am I trying to accomplish. And I just want long-term reliability. So that's why I did what I did.
Okay, so, and the next question is from a dentist who follows your Oasis posts quite frequently. And she's asking, in this case, you did not use posts. Would you explain why?
As I said, I did have a good amount of tooth structure apical to the old crown margin. And there was also, I failed to mention, a deep cervical notch from toothbrushing. So I thought if I could incorporate all of that into a new crown margin, I'm idealizing as much as I can. So in this case, I have, at least from the facial, I've got a good amount of an axial wall for good retention. Here I have removed or started to remove the old gutta percha, which on the surface was stained, but in the interior was patent and clean. So once I had done that, to use a post, not to use a post. I could have put a post in, and maybe on a different day I would have. But I'm looking at this and I thought, okay, I had done the endo some 30 years ago. And I'm looking at the top of the sealer and it looks beautiful. So I thought, why should I take out good solid gutta percha and somehow disturb that idealized seal that I have to place a post? There is a risk to placing a post. And given that the canals were not septic, I thought I have Here I've got a deep chamber to secure, as a retentive element to secure an amalgam core. And I've tried to highlight it there. So it's that wide, but it's also 2 to 3 millimeters deep. So I thought, okay, I've got that as a good solid retentive element. And then I've got this surface here, this flattened surface where I could place some pins. And that's what I went ahead and did. So now between the interior of that chamber and these retentive pins, which act as rebar, if you will, whatever core material I place there, and again, I'm just, amalgam for me is the only way to go. I know that it will all become one, and I now have a tooth and a core that will offer no problems over the long term. So again, we've got pins in it, we've got it embedded into the chamber. Could have used a post if I did not have this length of, or this amount of robust tooth structure remaining, and that was compromised. Perhaps I could have used a post or even 2 posts, and I've done that in the past with a tooth that was more compromised. But in this case, I thought, why disturb the gutta percha? Why engage the canals?
Perfect. Thank you so much for taking the time and responding to these questions.
You're welcome.